like to tell y'all a little bit of information about stroke and how it affects people. What is a stroke? A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving the brain tissue of oxygen and nutrients. Some of the symptoms of stroke that you might notice: somebody's going to have trouble speaking or understanding. They may experience confusion, they may slur their words, or they may have a difficulty understanding your speech. A lot of people experience paralysis or numbness of the face, arm, or leg. It typically happens on one side when you develop the paralysis or numbness. Also, one side of your mouth will tend to droop when you try to speak or smile. Somebody having a stroke could experience trouble walking. They may stumble or experience sudden dizziness, loss of balance, or loss of coordination. Not as typical, but oftentimes someone will have a sudden or severe headache. That's usually accompanied by vomiting, dizziness, or altered state of consciousness. These are signs or indications that you may be having a stroke. One of the best ways to determine when someone is having a stroke is the FAST rule, F-A-S-T. You want to ask the person when you look at their face, and you want to look at their face when you're speaking to them and see if there's any drooping. When you ask them to smile, if one side is drooping, that's a clear indication that someone's having a stroke. When you ask the person to raise their arms and they're unable to, that could be another indication. Speech may be slurred. You may have issues with speech. Time is of the essence. If you suspect a stroke, immediately call 911. There are types of stroke. An ischemic stroke is when the blood flow to the brain is blocked by a blood clot. So an ischemic stroke is when there's a blood clot, and it's two types. You have a thrombotic stroke, which occurs when a blood clot forms in the arteries, messing up the blood supply to the brain. An embolic stroke is when a blood clot or debris forms in another portion of the body, typically the heart, and is swept through the bloodstream to lodge in the narrow brain arteries. Risk factors that can contribute to stroke or causes of stroke are being overweight or obese, physical activity or inactivity. People tend to be couch potatoes and they have a hard time with being active, leads to weight gain, other risk factors for stroke. Heavy or binge drinking is also a great factor in those who have strokes or are prone to strokes. Blood pressure issues, diabetes, high cholesterol, family history of stroke, or family history of issues with blood pressure and high cholesterol can lead to more commonly having strokes or being causes of strokes. Men and women both can have strokes, but it's more common in men until they reach the age of 65. Between age 75, men and women are equally capable or equally likely to have a stroke. Race doesn't necessarily play a factor in stroke. It just depends on the history, family history of health issues. Although they are seeing an increased rise in Mexican Americans of having a higher incident of ischemic strokes and intracerebral hemorrhaging compared with non-Hispanic whites of the same age. Complications as a result of stroke could be memory loss, emotional problems, pain, changes in behavior, and loss of muscle movement. Some of these things you can recover, but not always. What do you need to do to prevent yourself from having a stroke? What are the factors? If you have high risk factors, what do you need to be worried about? You need to be worried about controlling your blood pressure. You can do it with diet and exercise, and sometimes with medication, especially if you're in that high risk category where it's a family history characteristic. Lowering your cholesterol and reducing saturated fats, you can do with diet and also sometimes with medication. Tobacco use, just a no for any type of medical issue. Quit any type of tobacco, not just smoking, dipping, anything related to